Well, good morning. I'm Jonathan Frank, Communications Director for the Better Medicare Alliance, and I'm here today with our President and CEO, someone that many of you know well, our host for the summit, Congresswoman Allyson Schwartz. And we've got about 15 minutes, and we thought we would just go through a few questions this morning. And we certainly invite you to ask your questions as well. You can do that using the chat box. So we'd love to have you ask your questions, and I've got a couple questions of my own to get us started this morning. So Congresswoman Schwartz, I thought to kind of kick things off, there's a lot of familiar faces in our virtual audience, a lot of people that know you and BMA well, but we've got some folks that are new to BMA that maybe don't know us as an organization or you personally quite as well, and would love for them to have a chance just to get to know you and BMA a little bit better. So could you tell our audience a little bit more about who Better Medicare Alliance is and the path that brought you here?
Okay. All right. Well, I always like this question, actually, and not everybody asks me that, but I have to say it's been very exciting, and I feel like I'm doing important work at BMA. So let me give a little background about how I got here, and then I can talk about BMA just really briefly, since many of you have heard it. But everyone seems to know that I was a member of Congress, and people still call me Congresswoman, which sort of become my first name, so it seems to work. But served for 10 years in Congress. From Pennsylvania, from representing part of the city and the suburbs, a classic swing district of Republicans and Democrats, leaning Democratic, but it was good. It was a great district. I did a lot of work in healthcare, and I'll step back in a little bit and say how I got to Congress, because I didn't just step into that. I've been somebody who's cared passionately about healthcare pretty much my whole professional life. My first job out of graduate school, I have a master's in social work. Community organizing, which Barack Obama made popular, and administration. But my first job was with a very sort of new starting HMO. So I feel like I've come a little bit full circle with the idea of integrated care and managed care as an option for maybe a better option in some ways than the fragmented fee-for-service system. So I go back to the mid-'70s when I did that work. I did leave to sort of do something rather adventurous as a 26-year-old, is to start a women's health center in Philadelphia, and ran that for a dozen years, did really innovative work from women's health care of all sorts to out-of-hospital birth center, and it was really important work to do in an important time, actually. And it was both providing innovative health services, and it was a little bit political because some of it was sort of sensitive politically. So got me really interested in politics and who makes the decisions about our lives. And so I got involved politically in just volunteering and helping people run for office, and got myself appointed to work for the Mayor Wilson Goode, in his second administration, and ran the Department of Human Services for a couple of years, and then ran for office. So I ran for the state Senate, rough election, and served there for 14 years. And again, you work on so many issues. I'm proud of the work I've done in elected office. But somehow healthcare was always my passion. A lot of work on how to make sure that insurance coverage was adequate and covered women's health care, and was known in Pennsylvania as the mother of CHIP, the Children's Health Insurance Program, 5 years before it went national. That was great. Pennsylvania wasn't always on the cutting edge of policy, but we got that done. And then ran for Congress and won, as I said, and served 2005 to 2015, and did a lot of work on the ACA. Really spoke up for primary care and that language, and changing the way we fund and pay for doctors, again, to encourage value-based care, the use of technology. I could go on, but I won't. So I ran for governor of Pennsylvania and didn't win. So had to sort of reinvent myself on what I do next. And I federal health policy, and the opportunity to start Better Medicare Alliance, to create an alliance of the many stakeholders who care about improving care for beneficiaries. And I understood as a member of Congress the importance of Medicare, because what we do in Medicare has a profound effect on all of healthcare delivery in this country. And so we got started, and 2015, 15 and grew from the original 10 ally organizations to now almost 150 organizations, really prominent national associations and those who represent plans, providers, all the community partners. Many of you are in the audience. And I think we've really made a footprint. I know we have made a real footprint in affecting policies. We've been able to work in a bipartisan way with Congress and with the administration, whoever they are, and to really make Medicare Advantage, I hope, a strong and vital program, and one that is a part of the future of healthcare in this country.
So we're at day 3 of our summit, the final day. We've had a lot of great speakers. There's more good content still to come, but would just want to ask, what has stood out to you so far? What are your takeaways from what we've heard so far at the summit?
Well, I am coming in and out of all of this, so I may have missed a few lines, but I do have to say, what strikes me is the tremendous commitment and determination of the plans, the providers, all of the speakers, whatever part of Medicare Advantage they do, to really use a platform of Medicare Advantage, that those capitated prepayment, integrated payments, that really can address the whole person. And you just see the interest not only in an ability and nimbleness that to respond during COVID, but also to really be able to think what's going forward, to really build on the opportunities around those who are chronically ill, the opportunities to work on social determinants of health. But it's really the creativity and ingenuity, and whether it's private companies or long-standing nonprofits, or again, plans and providers, it's really inspiring to hear that the work that they're doing and their excitement about doing it, and understanding that they really impact tens of millions of seniors every day is really, and again, helping to transform the way we provide healthcare is really fantastic.
So you talked a little bit yesterday about kind of looking backward. The Milliman report looked at 2013 to 2019, some of the trends in Medicare Advantage. You talked a little bit this morning about some of the enrollment projections going forward. CMS says it's going to be almost 27 million people in 2021. But if you were to kind of look forward, where do you see Medicare Advantage going, not just in 2021, but beyond?
Well, I think Medicare Advantage is here to stay. I think it's no longer a debate about whether this is a good idea or not. And I do think that we have great opportunities to build on the flexibilities that are inherent in Medicare Advantage. That's going to be important. We certainly are, as I talked about, very interested in seeing changes to the enrollment process. And that's really important. I'll continue to work on some issues that are coming up in terms of, how do you measure star ratings? How do you measure quality, which gets done in Medicare Advantage in a rather unique way. And I think that has some opportunities to modernize and improve what consumers care about and the consumer measurements, but also in moving forward on how do we address social determinants and how do we address those at high social risk. It's really I think the one issue really facing Medicare Advantage too going forward is maintaining that bipartisan support. And I do also think that the pressure of Medicare Trust Fund and the concerns about not having adequate funds for all the we already promised to do. I believe that we will meet that promise, but how we do that is going to be a challenging discussion. And I certainly I know what we'll have to do to work together is to make sure that we communicate that value of Medicare Advantage, the ability of Medicare Advantage to be able to provide at the same or lower cost of Medicare fee-for-service, better outcomes, and better benefits and healthier seniors. So we'll have our work to do. We're not done here to make sure that Medicare Advantage fulfills its promise as it's been doing and can really meet those needs of a growing aging population.
So we got a question from David. We've got about three minutes left, so I want to make sure I get to David's question. And he asked us, we know there's a change coming for 2021 where those with end-stage renal disease can enroll in Medicare Advantage. And he wants to know how Better Medicare Alliance has been engaging on this issue as we look ahead to 2021.
Well, it's interesting. It hasn't come up a lot in this summit. My guess is it's going to come up a lot in next summit because there's a major change coming in 2021, which is that those with the diagnosis of end-stage renal disease, which means they're already on dialysis, will be able to sign up for Medicare Advantage. The expectation is that they will sign up. Certainly the annual cost protections, the extra benefits could matter a lot to these people who are complex chronic conditions. And I think we welcome that opportunity, but it'll also be a challenge. So we're really interested to see how Medicare Advantage plans consider how they can both do the right kind of job in terms of identifying a chronic kidney disease earlier and helping people slow that disease progression so they don't end up on dialysis. That starts first. We need to be in a better place 10 years from now than we are now in the sense of so many people continuing on that path to renal failure. It's not a great path to be on, but also to see if they can change some of the models of the way renal dialysis is delivered, whether it's going to be more in-home dialysis or other sites of care is something that I think we're already seeing some real discussion within the plans as to how they can provide the best possible care for beneficiaries with end-stage renal disease. Some more to come on that.
So in the maybe just in the minute that we have left, obviously Better Medicare Alliance does a lot of research. We unveiled some new research yesterday that's on our website. You gave a little preview of an upcoming report that people can look forward to. Any other projects that you want to give our audience a little preview of this morning?
Well, like I said, we've been excited that we've created this research arm. It keeps us even more focused on how do we gather the evidence of what's working in Medicare Advantage, what is doing well, what challenges we might still have, what opportunities there are. So we will look at our website. We have great content. We try and boil it down to fact sheets and to issue briefs and that sort of thing. So take a look at all that, sign up for our policy alerts. But our Center for Innovation in Medicare Advantage will actually continue to produce these reports. I think the next one's up I talked about is the Avalere, done by Avalere Health, the analysis they did on high need, high risk beneficiaries. That's going to have a lot of data. We'll be talking about that for a while. And we also have one coming up. We work with NORC for the University of Chicago, talking about how we can modernize the consumer experience measures in star ratings. So a little heads up that that's on its way too.
Great. Well, that is all the time we have this morning. There's a lot of programming still to come today, so we hope everyone will stay with us. And thank you, Congresswoman Schwartz.
Okay. Thank you, Jonathan.